Hi, my name is Dr. Ilya Skolnikov, and I'm a holistic healthcare provider who specializes in helping women with hormonal imbalances and people who have trouble with their thyroid gland. What you could say is that you could say I'm a functional medicine doctor. You could say that I do naturopathic therapies in our office. We do therapies that involve integrative medicine. Do you ever feel frustrated about your current state of health? Are you even more frustrated by not knowing where to turn to get help needed to get your health back that you used to have? Is that even more frustrating by any chance? Do you ever find that you're experiencing more days where you have pain or feel tired than your good days, where you're pain-free and you have plenty of energy and sleep well at night? Well, just listen, continue to listen. I know you're busy like everyone else, but this is really, really important, and I promise it'll be well worth it. Because I can't tell you how many hundreds and even thousands of people that I've met who, if you said yes to 3 or more of those questions, are almost exactly like you. So a few more questions for you. We want to make sure we're on the same page. Do a variety of small but chronic ailments like headaches or hot flashes, night sweats, thinning hair, or brain fog, like I just said. Do any of those things undermine your ability to feel good in your body and prevent you from having enough energy to really get the most out of life? Do you find yourself taking aspirin or being reliant on caffeine or even prescription medications? Do you ever wonder why sometimes you feel older than you think you should? And you're young. Let's say you're in your 30s or even in your late 20s or mid 40s. Well, have you tried unsuccessfully for years to lose weight or get rid of stubborn belly fat? Trying diet after diet, different kinds of exercises, only to sort of not really get the results that you're looking to get? Well, these types of symptoms are chronic, and they involve the organs and glands of your body. We want to help you. So we want to help you get these symptoms under control. A lot of people, maybe you've been to a medical doctor already. Maybe you've been to a holistic healthcare provider, an integrative medicine specialist. You might have gone to a functional medicine doctor. You might have gone to your homeopath and naturopath, or you might have gone to your chiropractor or your acupuncturist or your psychologist, or you might have gone to the energy medicine doctor. If so, that's great, and they might have helped, and you might fit into one of several different categories. Maybe you're in a category where you felt better for a while and then you stopped feeling better, or you might have felt better and everything went pretty well, but you didn't quite reach the level of health that you were looking to reach. Or it could be that it just didn't work out at all. Well, there's most likely a reason for that. Let me go over that in a minute. There's only 4 things that would happen if you went to the medical doctor, by the way. You could have gotten prescription medications. You could have gotten a surgery, a radiation therapy, or a referral to a specialist who does drugs, gives you prescription drugs, or does radiation, or something like that. Yeah, maybe ultrasound or something like that to get rid of a gallstone or a kidney stone of some sort or nature. When you experience the approach to care that we are sharing with you here, there are an infinite number of different therapies to choose from that are specific just to you. We're not going to force you into 3 different categories, only that just doesn't seem friendly. So according to the research done by the Mayo Clinic and Olmsted Medical Center in 2013, almost 70% of Americans were taking at least 1 prescription medication, and greater than 50% of Americans were on more than 1 prescription medication. Most of the Americans were taking this medication almost every day. The most commonly used medications are antibiotics, antidepressants, painkillers, and also, blood pressure meds and cholesterol meds. So I'm just trying to, I thought about this and I thought, is the pursuit of affluence really that painful and depressing? Americans consume nearly twice the amount of sugar as do all other 54 industrialized countries in the world combined. In America, we're fat, but we're undernourished, and it's killing us. If you're currently using prescription medications, wouldn't you like to be able to no longer need the prescription medications and feel better without them than with them? Why wouldn't you? If you're scared that your symptoms would come back if you went off your medication, or it would not be so safe to do so, then you can put an end to all those concerns and you can put them behind you. The approach that we're sharing with you here is completely different and infinitely safer than any type of dangerous and long-term medication of any sort. And there's no side effects. And it's very safe. And we measure you on the medications that you're on. So if you're on medication, we determine if you need more of the medication or less of the medication, or maybe you need to switch a medication. So everything we're doing is very scientific and very left brain, so to speak. The undesirable consequences of taking certain types of prescription drugs are the well-known and well-researched effects of the prescription drugs. They're not side effects, they're the effect of the medication. So what we want to do is not have to deal with the craziness anymore. It's entirely possible that you've already been to see a holistic doctor, like I was saying before. But I can promise you, because otherwise you wouldn't be watching this, you have never been to anyone who used chiropractic, homeopathy, herbs, nutrition, and allopathic diagnosis. They were a functional medicine doctor. They used traditional Chinese medicine, and they were trained in it. And they'd been to acupuncture school. They'd been to chiropractic school. They knew how to do muscle work. They were a diplomate of the International Board of Applied Kinesiology, which is the highest level of training one can achieve in the world of applied kinesiology and muscle testing and functional medicine. They understood all these things, okay? They understood the herbs. They understood the flower essences and how they work, and when to use what medication for what purpose to get the best result with your body. And they even did the emotional therapies, the psychotherapy. So when you take all these things and you put them together into one system of diagnosis and treatment, you get amazing, phenomenal results. I have this one patient, her name is Cynthia Tom, you can see her on my website. And she was having depression, so she was having to take an antidepressant before she went to sleep. And she also was taking a sleeping medication. She was having to take a blood pressure medication and a cholesterol medication. She decided that she wouldn't take the cholesterol medication even though her doctors urged her to. So like I said, she needed pain meds. There was a lot going on with her. She was overweight. She was all sort of puffy. She was about 48 or so pounds overweight, maybe more. And it took some time, but she also had pain in her knee from a bunch of failed knee surgeries and a number of surgeries in her back. And after a number of visits, I mean, it really did take about 6 or 7 months or more, she no longer needed the antidepressant. She no longer had the high blood pressure. She no longer needed the medication for the high blood pressure. Her cholesterol levels were balanced. She no longer needed the Ambien to go to sleep. She no longer needed any of those medications. She lost 48 pounds. She's thinking clearly. Her mood is stable. The knee pain and back pain is gone. I mean, everything in her life has changed around completely. And I want that to happen for you. I really do, because I got into this not because, I thought it would be, the most, thing that would give me the most free time or anything like that. I got into this kind of work because I wanted to help people the same way somebody helped me with many of the same symptoms that I'm talking to you about here. So thank you very much for watching this video, and we hope to help you and see you soon.